Hi, everyone, and welcome to Nonprofit Narratives. I'm Ashley Arfay, the CEO of Southwest Louisiana Area Health Education Center, better known as SWLAHEC. I'm joined today by our board president, Dr. Tahisa Colbert, and our director of Career and Professional Education Services, Brooke Voorhees. Welcome, and thank you all for joining us. Today, we're going to talk a bit about the work and impact of SWLAHEC. And it's especially important for us this year because we're making 35 years of community service. That's in our region as well as throughout the state. So we're going to talk to you a bit about where we've started, how far we've come, and where to head for us. Dr. Colbert, I think we're going to start with you, if you don't mind.
Okay.
You've been with the organization for some time, so you can share with us how we started and what's the mission that we started with.
Well, SWLAHEC started back in 1996, where our focus at that particular point was access. Basically, access to the community, having access to us in terms of making the programs available, healthcare information, helping the community to realize what opportunities were available to them to receive access to healthcare through our efforts.
Okay, and that sounds a lot like our current mission, which is to impact the health status of communities through access to education, information, and of course, healthcare services. Now, you said 1996, and you may be confusing that with the year you started 25 years ago, but I believe the organization started in 1991.
Pardon me, you are correct. I was thinking about my own anniversary this year as we were preparing this morning, that I've been a board member for 25 years, which is basically speaking to the understanding of the importance of healthcare and how I support the mission of the work that we do.
That's awesome. That's great. Now, let me ask you this, because we spoke a lot about mission, and we've already shared that it hasn't changed much, but tell us more about how the organization has expanded over the years.
Well, back when I first became a board member and learning of SWLAHEC and our various programs, our focus was basically to bring awareness to those who are interested in healthcare opportunities, interested in careers, and that was our focus point at that particular time. And that has come full circle. Not only are we trying to engage our younger generations to consider healthcare careers as opportunities for their own personal growth, but to also make the community itself aware of the various programs and access to care that we have available to them, whether it's through educational opportunities, finding a local clinic that may be around the corner from them, helping them to develop what type of medications that they need to be aware of, and how to gain access to those various avenues of healthcare, and not just focusing on what's right in front of them. We want to let them know that we have resources that are available to them that they can take advantage of.
Good deal. Thank you for that. And I also want to make note, because you've been on the board for some time and you're our board president, would you like to share a little bit about our makeup of our board, or at least what's your credentials?
Well, I currently serve as the board chairman, and I am a dentist, a general dentist by trade and profession. I also hold a master's degree in business administration with an emphasis in healthcare, which helped me when I served on various other boards and organizations affiliated with healthcare in general. Here in the state of Louisiana. For a snippet, I was the state dental director, and I served as the chair of the Fluoridation Advisory Board.
Good deal. We enjoy having you, I'll tell you that much.
And I enjoy being a part of the continued work that we do as an organization.
Thank you. Now, Brooke, you've been with the organization for some time as well. Give me a perspective of what it is to be a part of the SWLAHEC team today.
So I have been here with SWLAHEC for 9 years now, and day to day we do so much. I know we have different programs and we have different departments, but we all work together to achieve our overall mission. And just day to day, we have so many programs being run. We have so many people out in the community doing community service work and helping our communities. So it's a really fun time, and it's really interesting to hear when we go out in the community. We hear a lot of people say, oh, I did a heck of a summer, or I did one of these programs, and it's just so rewarding to see those people in those positions who are not only alumni of ours who have done our programs, but how they're also helping to work with our other programs and just continuing on with our mission and to continue working with us.
I agree with that. As you shared, so many individuals connect us to those AHEC programs, and that's tremendous. Let me ask you this. What are some things that you think people don't know about SWLAHEC, though?
I think some people don't realize that we do have so many other programs that we do and so many things that go on at AHEC. Again, we go out into the community and all the time we hear, I did that program, I did AHEC of a Summer. And AHEC of a Summer is our longest running program. It's been around since, and we'll talk about that later, but it's been around since the organization started. So that's a lot of what people know us for. But we do so many other things, and I'm excited to be here today to share those other things that we do. And I think that's the most surprising thing, that people out in the community hear about something else and they're like, oh, that's also AHEC. And it's really nice to be able to show them that.
I agree. I'll say we may not have enough time in this segment to talk about the many programs that we have in the organization, but I'll put a number to it that I know for sure we're 30 plus programs that either hit region or statewide. And so that's phenomenal, saying that it's from a nonprofit healthcare organization. So thank you for that. I agree. Dr. Farber, do you have anything that you think during your time as, from the board perspective, is something that many people don't realize that SWLAHEC does?
I think it's the connecting of the dots that we do behind the scenes. I would like to think of our organization sort of like a quiet storm.
Mm-hmm.
It's making an impact, but everyone may not be aware of the impact in terms of the broad spectrum that we cover. Giving kudos to Brooke with the work that she does as one of our program directors. And I have a keen interest in the programs and making sure that we continue to expand our horizon, so to speak, as we move into our anniversary year and bringing that at the forefront of what our mission is.
I like that. I think I agree with that, in that many times our programs are all linked based on community coverage and care. No matter what, we make sure that the individual has a pathway to their healthcare needs. So Brooke, let's talk a little bit about these student programs, because you mention it so often. You play a huge role in our student programs, but it also plays a huge role in SWLAHEC. Tell us a little more about those programs.
So we have programs that start all the way, through elementary school, through med school, through college and beyond. So we have some of our programs. We run A Heck of a Smile, where we're out into elementary schools. We have Camp Fast Forward, which is in, our middle school programs. A Heck of a Summer, again, which is our longest standing program we have for our high school students. We have our AHEC Scholars program, where we're out in the colleges and universities throughout all of South Louisiana. And then we also do continuing education for health professionals. And our goal with that is we create a pipeline. So we have a pipeline of programs. They start elementary, we move all the way on to, health professionals. And our hope is that once these folks become health professionals, they come back towards the front of our pipeline, and they continue to help those students who are just getting into our pipeline. So we have a lot of programs. We serve probably around 400 to 500 students a year from elementary and beyond. So we have a lot, and we're always looking for more programs, but our goal is to make sure these students know about health careers, things that they don't know about. A lot of times these students have only seen a dentist, a doctor, or a nurse, so they've never seen something other than that. So we want to be the ones to show them you don't have to be a doctor, a dentist, or a nurse. You can do so many different things.
Yeah, I like that. And you touched on this, as well as Dr. Colbert, the importance of starting early. Share with our viewers why it's important that we start at that elementary age.
Yeah, so it's really important to start early because, again, a lot of these students will only hopefully see a dentist, a doctor, and a nurse in their lifetime, while they're growing up. And it's really important to show these students that there are people that look like them, that come from the same backgrounds that they do, that have made it, and they are health professionals. So it's really important to bring health professionals to them and expose these students at a really young age to people who are just like them, and they did, something great, and these students can also do that, and that's what we're here for, to show them how to do it, show them those people, and help them along the way.
It really speaks to the importance of continuity and how the pipeline is not meant to just kind of one time engage, but to engage throughout that whole entire process. I know our ultimate goal is to ensure that they practice here, right? That they stay within their communities, their rural spaces, and then they become the faces of what may have not been seen before. So that's awesome. That's great. Any more information you'd like to share about your AHEC programs? And let me be more specific. Share with us what's ahead.
So right now we are currently working on our Day with the Docs program, where we take students to LSU Health Science Center in New Orleans, and they set up a whole fun day for the students. It's one of my favorite programs because we get to do all the things, touch all the things. The students at LSU just put on a phenomenal day for our students. And then we're working on A Heck of a Summer, which is going to start this summer. So again, our biggest program, so much goes into that. And then moving forward, it's a lot of what else can we do in the community? How else can we impact these students? Because while we do impact a large number of students, we're always looking for more things to do, and we're always looking for more partners who believe in the work that we're doing and believe in getting these students into health careers. So, and hopefully those partners have health facilities where these students will come back and be health professionals one day. So we're always looking for new opportunities, and we're always willing to jump on those opportunities.
Good deal. And not only do we want to stay connected with these students that are rolling into our programs, but also those that have been participated in the past. So I know that we definitely want to talk about Louisiana AHEC Alumni Network. And so we'll probably talk about that when we come back from after this break. Thank you all for tuning into Nonprofit Narratives. We'll be right back.
Looking to grow your nonprofit's impact? Join AOC Community Media for Nonprofit Nourish, a quarterly meetup designed to connect, empower, and elevate local changemakers. Each session features expert-led workshops, free headshots, PSA recordings, and a light lunch, all at no cost. Topics rotate quarterly, spotlighting a range of areas including storytelling, media strategy, and community outreach. Space is limited. Register now at aocinc.org/nonprofit, and let's nourish the good together. Whether you're just starting out or leading a seasoned organization, there's a seat at the table for you. Let's build a stronger, more connected nonprofit community, one story at a time. Acadiana nonprofits are the heartbeat of our community, and Nonprofit Narratives brings their stories to life. Produced by AOC Community Media, this half-hour series showcases local organizations, highlighting their missions, impacts, and the people they serve. From youth mentorships to environmental advocacy, each episode celebrates the voices driving change across Acadiana. Tune in to AOC Channels 1 and 2, stream at aocinc.org/watch, and download AOC's streaming app found on most streaming platforms. Real stories, local heroes. This is Nonprofit Narratives.
Welcome back to Nonprofit Narratives. I'm Ashley RFA with SWLAHEC. We have a new guest joining us. This is Kiara Mouton-Thayard, our Director of Community Health, and we still have Brooke Voorhees joining us as well. Kiara, how you doing?
I'm doing good today.
Good deal. Well, I'm happy that you're able to join us, and you can tell us a little bit about our community programs. I know you have a lot of programs, but what are some of the ones that you want to highlight today?
Definitely want to focus on some of our diabetes prevention and self-management programs, along with our blood pressure self-monitoring. These programs, as simple as it sounds, folks go into their wellness checks, they'll get their diabetes screening done, our blood pressure check done. That is not happening. So along with partners, we ensure that we have these programs rooted in the community. So things like our diabetes prevention and management programs, where people learn to grocery shop, they learn to eat healthy, make little lifestyle changes, learn how to read labels in the grocery stores. We partner with a lot of students just to help and advocate for some of these resources and education.
Good deal. So from what I understand, and I'll be honest, your department is one of our newest departments in the organization. So kudos to you for I mean, that's new to the organization, but then also it's really boots on the ground. So tell us more about what that ground looks like.
So I will start with this. It's hard work. Hard work is hard work, and that's what we do. First and foremost, we ensure that we're listening to the community needs. It's one thing to sit all in the nonprofits, sit with the Department of Health and say, this is the programs we think the community needs, but we actually go out into the community. We hear what they need, whether it's resource management, healthcare services, connections to navigators, mental health, maternal health. We ensure that we're making programs that's practical and meeting the needs of the communities we serve.
Okay, so I'll ask you this because you mentioned that sounds like a lot of work. Explain to us and to the viewers who does a lot of that work, because your workforce looks a lot different.
Yes, definitely looks different. So one of our strongest roles in the community department is our community health workers. These are the boots on the ground liaison folks. These are our community leaders. These are people from specific communities that we train them and we put them back in the community to do this work. So whether it's being a navigator and ensuring that they get to the resources, they're making sure they're setting appointments, they're doing blood pressure screenings, they're making those phone calls, they're making sure transportation is happening, whatever that need is, they are the connector. So they're connecting the folks in the community to us, the folks in the community to a provider, the folks in the community to Medicaid, Medicare, whatever that looks like, they're that liaison. We call them different things throughout the state. So navigators, community health worker, case management, but they're all doing that community work, just being a community leader.
And that definitely speaks volumes to sustainability and longevity, right? Because that's truly putting the needs back into the people's hands, and so that they can lead these efforts. I like that. So that also tells us a lot about impact. Share with us some of the impact that you've seen or noticed throughout the years doing this work.
So from little impacts to great impacts, just the small lifestyle changes we see. We have people going into physician's office more. We see people actually paying attention when they're picking up food, checking labels. We're getting phone calls. We're having students actually able to help the community, help their parents read a label, help them understand more about diabetes, heart disease. We do a lot of advocacy work with students in our Empower You program. A lot of that are students who want to go into the healthcare field, so it's an easy, warm referral to Brooke. And that looks like people having a voice, people knowing how to go into clinics and to their physician's office and ask questions. I know a lot of times we hear when we're at meetings, well, I didn't know what to ask my doctor, or I didn't know what to tell him to look for. I didn't know I had high blood pressure. We're giving them the confidence to be able to navigate through the healthcare system. And sometimes that includes us still helping a little bit, but it's a confidence that they don't have before they meet us and they work with us.
Good deal. I'll also share this. You spoke about the student program. Can you elaborate a little bit more about that?
So our Empower You program, which is our newest program, right now we're in a pilot stage, but we have worked with over 400 students throughout the state of Louisiana. And this program is focused all on wellness and advocacy for students. So these students are able to advocate for needs they see within their schools or their communities. They learn about healthy eating, how to grocery shop, financial literacy, exercising. They are able to meet with local council members and talk about the needs they're seeing in the community. And for those who want to go into healthcare, we actually introduce them to some of Brooke programs, and we introduce them to the different aspects of healthcare. We know everyone is not a nurse or a doctor. We tell them about public health. We tell them about counselors. We let them know what a registered dietitian is. They are able to meet all of these folks throughout the course of the program, and it helps them to advocate for themselves and to really have a voice, whether it's in their community or in their schools or all of it.
That speaks volumes to Brooke, again, what you mentioned earlier, is that we have to start with them early, young, and already implementing and teaching them what that looks like, right? Now, I'll also say this, a lot of the work you do doesn't always sit in a program, but a lot of times it's events, right? It's out in the community, either part of someone else's event or creating our own events. We have one coming up. You want to tell the viewers about that one?
Yes, of course. So a lot of work we do, of course, Everything we do is free to the community, and it's to meet people where they are. We want to bring them the resources. We want to bring them the screening, the support, whatever that is they need. So our upcoming event is our 4th annual Love Yourself event, my favorite. I think everyone in the world knows. And we focus on women's wellness. So anywhere from mental health, dental health, vision health, you name it, we have physicians there to talk about it, to mingle with the community, kind of take that white coat syndrome away. They're able to walk up, ask questions, dance, eat, everything with the physicians that serve this community. Our event this year will be hosted February 21st at the Karen Crow Community Center. We're expecting, again, anywhere from 200 to 300 women to come out. We do not exclude males, so if we have males who want to join us, it is open to everyone. We have young ladies. We have a big organization at UL who will be supporting it, doing a lot of our volunteer work as well this year. And we just want women to come out, celebrate. The theme this year is taking off the mask. It's going to be right after Mardi Gras, so everyone's still going to be in the spirit of Mardi Gras, festive. But we want to take off the mask, not only the mask, the Mardi Gras mask, but the mask we wear every day as women, as wives, as mothers, as workers, running households. We want to really, truly have this day for women to embrace all the struggles we went through this past year and to embrace what 2026 has to offer.
That's awesome. That's awesome. You know, a lot of what you mentioned is the importance of health literacy and meeting people where they are, but then also mobilizing those services. So many times when we can't ensure that that person gets to that healthcare facility, that we can at least mobilize that service to them. And then also the connection in which it works hand in hand with other programs, such as our student programs with Brooke as well. So thank you.
Thank you.
Like you said, hard work is hard work.
Hard work is hard work.
There we go. Good deal. Now, Brooke, back to you a little bit. You work closely with the student programs, and Kiara mentioned quickly, and I just want to get back to that. How can that transition for a student who starts in that Empower Youth space, or a community health worker that starts in that community health space, how could they see themselves connecting to those AHEC programs?
So our AHEC programs are open to any student that applies to these programs, but whenever Kiara goes out in her programs and works with these students, we always let them know, like, hey, here's the next step. Here's something else you can do with AHEC to kind of see what it's like being in underserved medicine, rural medicine, other health professionals that you can possibly look into one day. So we always try to make sure we're not working in silos in our programs, and we're really touching all of them, all the programs, all the students, and we're just really letting everyone know, like, hey, we have a next step for you. Let's help you get there.
You know, I like that you mentioned that, because not only are we working with the students, we focus on the whole family. Mm-hmm. And another question that I know, Kiara, your team always asks in the field is, who's your healthcare provider, right? So even more important, we have a program, Navigators for Health of Louisiana, which is our statewide program. And this program focuses on assisting individuals and families on applying for Marketplace as well as Medicaid applications. Now, a big myth is that we only do this during open enrollment, and that's not true. Our work is year-round, where we're helping families navigate not only the application assistance, but renewals as well as life changes, right? Many a times you may have job changes, income changes, growing families, and we're there to help. We're there to ensure that not only do you have insurance, but that you're able to maintain it and not lose coverage. So, Brooke, you and I have joined that team within the last year.
We have.
It's been interesting,
It's
right?
been interesting.
It's nonprofit work. We do all the work.
All of it.
All of it.
So let me ask you a quick question. Since you've been in that space for a little while, what would you say is the biggest challenge you notice the individuals and families face?
I believe the biggest challenges they face is just the uncertainty and the misinformation out there, and it's overwhelming whenever you may lose health insurance or your family changes, your income changes, and you need to change your insurance. Where do you go? Where do you start? What do I do now? What am I eligible for? So we, again, have navigators throughout the state of Louisiana. It's a year-round program. It's not just during open enrollment, but we have those folks that are here, trained, ready to help let you know what you're eligible for, who you need to contact, where you need to go, help out with application process, and and then helping you decide on your health plan, giving you the most up-to-date factual information on what health plans they have out there, and really walking you through this so when you leave, you are sure of exactly what you've just done, and you're ready to, continue your health journey.
Yeah. You know what else I truly enjoy about having this kind of work within an organization like ours is not only do we make sure that those individuals are connected to insurance coverage, but we also make sure they're connected to any other services such as SNAP, healthcare services, or whatever that looks like, especially through our connections with community health workers. Right, good deal. So I would like to say thank you all for joining us, and I think it's time to wrap things up. But what I will share and say that I noticed from our talk today is how connected our work stays, and it is, right? That how much SWLAHEC work ensures that it connects to community, coverage, and care. Again, this year we're focusing on 35 years of service, and I think we spoke well in sharing how well that looks like and where we're going. Thank you all for joining me to share our stories, and thank you all for listening. I hope you enjoyed Nonprofit Narratives with SWLAHEC today. Thank you.